Dear colleague, welcome to this introduction to the surgical courses. The material has been divided into 3 separate courses, which should be taken in order of appearance. We start with DBS implantation, we then continue with DBS implantation, variations, replacements and revisions, and finally with avoiding and managing surgical complications. These 3 courses are thus focused on DBS, while lesional procedures and biopsies are dealt with in separate courses. The first course is also the most extensive, consisting of a total of 9 lectures, 5 of which are video lectures. The default mode in the surgical courses is image-based surgery with frame-based implantation of electrodes in general anesthesia without intraoperative MER or stimulations. Other options will be dealt with in the next course. There are of course many ways in which you can perform a DBS procedure, and this is discussed in the lecture Surgery Logistics. The intraoperative evaluations will have a pronounced influence on how you choose to organize the procedure, and this is dealt with in detail in the course Intraoperative Evaluations and will not be repeated in detail in the surgical courses. In the following 6 lectures, we will deal with the preparations before the actual implantation. And the most important lecture in this course is naturally Implanting a DBS system, where we will in detail discuss the different steps of the procedure and how these can be managed in a simple and safe manner. You can of course not learn everything from the internet. You will need also clinical training. But you can combine your reading with practical training, and you will learn much faster if you don't have to learn everything, including the practical details in the operation room. So concerning the hands-on training, try to get a complete set of discarded or explanted implants and the equipment provided with these, and practice outside of the OR, assembling the frame, mounting the frame, how to prepare the arc and mount it on the frame, as described in the lectures, measuring the electrode and applying the stop, and applying the electrode holder and then locking the electrode. In the next course, we will look at alternative ways of performing the procedure. There are many stereotactic systems, but most are only of historical interest. Unfortunately, we can't include the lectures on how to use these individual systems in this course, since we are not allowed to mention different companies or product names for CME accreditation. However, you can always find those lectures in the lecture list. The most common way of implanting an electrode is by using a cannula, and that is the topic of the first lecture by Hiroki Toda. Different ways of anchoring the electrode is discussed in detail by Anders Fythagoridis and Terry Coyne. Await surgery, implantation of several ipsilateral electrodes, stage procedures and revisions will also be discussed, as well as IPG replacements. In the final course, we will discuss how to avoid and manage surgical complications. We will look at infections and erosions, hemorrhages, cerebral venous infarction, intraparenchymal cysts, electrode breakage, Twiddler syndrome, straining connection cables, external influences, DBS emergencies, and finally general contraindications to DBS. And with this I end this short introduction to the surgical courses. Thank you for your attention.